Hey, it's Todd Nelson with HFMA, and I'm here with Kenny from Macedon Technologies, and we're going to have a conversation about healthcare finance.
Absolutely.
So, can you give us a quick overview of Macedon Technologies? Who are you? What makes you different from other software companies?
Sure. We've been around for about 17 years. At our core, we're a business process consulting organization, but what we really do is build custom software solutions to solve whatever complex mission-critical need is in front of us. And that could be for really any kind of organization. But in the last few years, we've carved out a niche in healthcare revenue cycle because that really meets that definition of complex, mission-critical revenue impact. It's important that we can get into these organizations and solve those problems.
So, thinking about revenue cycle management, it's a pretty complex space. What are the specific pain points you're helping providers solve, and where does that work begin?
Sure. Revenue cycle, it is a complex space, and we are active in really the full spectrum of services that you might need. So that could be accounts receivable, cash posting, denials and appeals. But a big one for us in the last few years has been the No Surprises Act and intending to fully automate end-to-end the independent dispute resolution process to allow providers to engage with that. And that has been very important to allow providers, especially out of network, to capture the full scope of that revenue. So that is a great place to start, but in full honesty, the ability for us to build custom solutions means we can meet organizations where they are and solve whatever the problem is.
And that IDR is an issue that a lot of organizations are dealing with, not sure how to tackle. So finding a partner that can help them with that, automate it from a technology and consulting makes a big difference.
Yeah, it's evolving. We just had the CMS final rule come out, and we're expecting changes over the next few years. And the solutions that we're offering are really ready to adapt to that. And we're keeping an eye on the new portal as information comes out to make sure our automation connects directly to that.
Makes a ton of sense. So who are you actually working with today? What kinds of healthcare organizations have you partnered with?
It really runs the gamut. It could be from one of our partners, the largest medical transport organization in the country, down to a single freestanding ER facility, IONM groups. It could also be the RCM organizations themselves. So we have a lot of vendors here at the conference who are providing these services as well. We want to allow them to scale up to serve their clients the same way that the providers are served themselves.
So you really can meet not only the provider, but even the RCM vendor community and assist them with their clients as well. Hit it from both angles, if you will.
Yeah, the method is to enable any organization to bring these functions in-house with a team that doesn't have to scale way up to capture that volume, and that could be an RCM organization or the providers themselves.
So can you give me a concrete picture of what the before and after looks like for one of your clients?
We usually find organizations, small team, very capable, but they're drowning in spreadsheets and email, and they're having trouble keeping up with the growth expectations from the top down. The phrase I've heard many times at the conference so far is do more with less. And so what we try to do is introduce the technologies that we provide to increase the level of automation, to empower the individuals with more information to make high quality decisions. And so take the No Surprises Act, for example. We will automatically ingest every email that comes in the door, route that to the correct individual or automation on the end. We will go into the public facing portal and initiate the independent dispute resolution process directly, enable reporting, also the IDR entity reselection process as well, fully automating that to meet with your strategies.
Kenny, I really appreciate your time today and sharing your insights and some of the things that Macedon Technology does with their partners. I hope you have a great conference and appreciate the time.
You too.